Breaking news that's coming in at the top of this hour. Another China virus alarm. Health Ministry closely monitors China outbreak. Health Ministry sources have told India today it's a cocktail of viruses that is leading to a surge in China. Rare diseases medicines will now be made in India. Low risk to India. And that is what the Health Ministry has said, which is some good news. And India is prepared for any exigency is what the ministry has said. Shiv Arur is now joining me live on this. Shiv, there's obviously a lot of scare. There's a lot of pandemonium already on social media with those videos from Chinese hospitals going viral. How is India preparing itself because of this outbreak in China?
Well, some words of reassurance, preliminary words of reassurance from the Health Ministry, who've just held a briefing, Polomi, where they've said there is low risk to India because the transmissibility of both the H9N2, which is the avian influenza, which have a handful of cases in China, plus the group of respiratory pneumonia type illnesses that have broken out in at least two big cities of China. Are not an immediate cause for great worry because the transmissibility is pretty low. There are no deaths reported so far, and things appear to be under control on the international scene. However, at least from reading between the lines from what the Health Ministry has just announced, because the WHO has just put out a statement advising China to bring back COVID-like restrictions, at least in the Beijing area as well as Liaoning. These are the two places in China where pediatric hospitals and clinics are completely overwhelmed by this sudden spike in cases of what they're calling walking pneumonia. It's not one particular pathogen. Apparently, it's a group of different respiratory illnesses that have suddenly spurted as a result of the relaxation of COVID-19 norms in both these places, which had been hit very hard, as you remember, by COVID-19 across different waves. So it's going to be a bit of a wait and watch right now. The only thing is the Health Ministry, it's a once bitten, twice shy issue as far as China is concerned, not just for India, but the entire world, Polomi, because China now has a reputation of, hiding information, hiding data, not revealing the reality or the seriousness of the situation. There is a degree of opacity as far as access is concerned in many of these places. So I imagine, unlike COVID, where many countries, had to react too late, after which transmission had already taken place, this time there's going to be extra caution exercised by countries across the world, including India.
Right. In fact, let me take that question with Sneha, who's also joining us at the moment. Sneha Murdani was, in fact, at that briefing. Sneha, do we have a better sense and understanding this time as to what exactly is it that's happening in China at the moment? What is the Health Ministry telling you?
Polomi, I can tell you from our sources in the Health Ministry that the videos that have been circulating is something that India is looking at very carefully. There is a sense of suspicion also that some of these videos possibly may not be from now, but they don't know yet, is what they're saying. Limited information, but the suspicion is that there could be a surge, and the surge is basically being attributed to a couple of factors: respiratory infections, circulation of the common pathogens that they do during the winter season, mycoplasma pneumonia, which China is right now talking about. But the Indian government not taking any chances, as we know. India is looking at the possible increase in cases in China, particularly. And I think Shiv pointed that out very well, that learning from the lessons of the past, there is in fact a sense that we need to react sooner, faster. This is not 2019 when for 2 months or 3 months or so, when the infection, in fact, was already circulating in Wuhan around the month of November. And the world got to know about it only post the 30th of December. That is a situation that should not arise. And that's the reason why the Health Ministry has taken cognizance of these developments, these videos, and very sketchy information from China. Though the WHO now says that China is, in fact, cooperating. They've, in fact, said there is nothing unusual about it. But if you ask me, as the Health Ministry thinks that there is nothing unusual about it, I think the answer to that is no. They are going to look at the situation. They say it's a mix of factors. But even if it is circulation of pathogens that happens in the winter season, it has come faster this time around. But there is a sense of suspicion that there perhaps could be more, but India is monitoring the situation, and that this is not something that can be ignored, given our lessons from 4 years ago. For me.
Right. Sneha, thank you so much for joining us with all of those details. Also, thank you to Shivaru.